Good day, I'm Dr. Ebony Alisa Divesa, and we will be discussing topics about depression. There are a lot of people who are asking me, what is depression? What causes depression? How to prevent depression? And what really starts depression? Theories or treatments and prevention about depression. We have a lot of patients in the outpatient department and those who are admitted to the psychiatric ward who are experiencing depression, most likely or most commonly major depressive disorder. These patients have experienced decreased appetite, loss of interest in different kind of activities that have given pleasure prior to depression. Those patients who have weight loss and even weight gain, who have increased sleep and decreased sleep. Patient also experiences loss or decreased energy, social isolation wherein they want to be separated from the crowd, or if they usually come with their friends, this time they don't want to be with their friends. And if they enjoy sports prior to depression, during depression they have less interest with their hobbies and interests. So we will discuss now topics and anything which is important about depression. And I hope it will help you, your friends, and your family. So please share and subscribe to my channel so that you will be updated to the future lectures. Globally, depression is the leading cause of ill health and disability, according to the World Health Organization. As much as 300 million people around the world suffer from it. This is 18% higher than in the previous decade, that is 2005 to 2015. The Philippines has the highest number of depressed people in Southeast Asia. Yes, our country, the Philippines. The National Statistics Office reports that mental illness is the third most common form of disability in the country after visual and hearing disabilities. It is reported by the Global Burden of Disease Study in 2015 that 3.3 million Filipinos suffer from depressive disorders. Now we are 104 or 105 million in the Philippines. With suicide rates in 2.5 males and 1.7 females per 100,000 of the Filipino population, according to the National Center for Mental Health. Most suicides are among males in their 20s because suicide attempts is highest in females, but completed suicide is highest in males. What are the causes of depression? Sometimes major depressive disorder-like symptoms are caused by other psychological disorders such as bipolar disorder, delusional disorder, psychotic disorders, and schizophrenia. Even though there may be very similar symptoms, these cannot be classified as MDD. So we will be focusing on major depressive disorder in this lecture. Stress accompanying the first episode of depression results in long-lasting changes in the brain's biology, loss of neurons, and excessive reduction in synaptic contacts. So as a result, a person has a high risk of undergoing subsequent episodes of a mood disorder even without an external stressor. Again, even without an external stressor. Other that can cause depression is losing a parent before age 11 years old, or losing a spouse, unemployment, which is 3 times more likely than those who are employed, and those who have excessive guilt. Depression can also be a result of personality factors such as obsessive compulsive disorder, histrionic personality disorder, and borderline personality disorder, but we will not be dwelling on these disorders in this lecture. Depression, according to psychodynamic factors, can be, according also to Sigmund Freud and expanded by Carl Abraham. Disturbance in the infant-mother relationship. That's why it's very important to establish the trust versus mistrust and the oral phase of the relationship, which is the infancy stage of the baby. Depression can also be due to real or imagined object loss, interjection of the departed object is a defense mechanism invoked to deal with a distress connected with the object's loss, or because the lost object is regarded with a mixture of love and hate. Feelings of anger are directed inward at the self. That's why there is self-harm to those who have depression. Depression can also be due to the high ideals and the inability to meet those goals. Like, for example, in school, you want to be the valedictorian and you have that high ideals. But in the end, you are not even included in the top 10. So, there are other children who have depression. The reason is having a low grade or not achieving the highest award during recognition or graduation. Another cause can be similar to powerless, helpless child victimized by a tormenting parent. Some depressed people have lived their lives for someone else rather than for themselves. And then, when they realize that the person or ideal for which they have been living is never going to respond in a manner that will meet their expectations, then they undergo depression, self-harm, and even attempted suicide. Another one is the assumption that developing self has specific needs that must be met by parents to give the child a positive sense of self-esteem and self-cohesion. That's why it is very important for the consistent presence, physically and emotionally, of the primary caregiver and the parents. There is what we call Beck's cognitive triad by Aaron Beck. So, the depressed person have a negative view about oneself. For example, Waikopoulos, I am worthless, I am good for nothing. Negative views about the world, everybody hates me because I am worthless. There is no future. Therefore, the negative views about the future. I'll never be good at anything because everyone hates me. There is also biological theories like the imbalances of the neurochemicals in the brain, because depression is actually in the brain. It's not in any body parts. Okay, there is imbalances of serotonin, norepinephrine, and dopamine, which are naturally present in the brain and assist communication between the nerve cells. Depression is more common in people who have biological relatives and depression. So, you have to ask your mother, your father, grandparents if there are one or at least one in the family who have experiencing depression, nervios, or who have consulted a psychiatrist. Please take note of this signs and symptoms of depression. We have this SIGI caps, sleep changes, interest loss, guilt, worthless, lack of energy, poor concentration, loss of appetite, psychomotor agitation, retardation, and suicide. Of course, sadness most of the days. There are treatments for depression. For pharmacological, we give antidepressants for the patient. And it will depend on the recovery of the patient, if how long will it be. For the therapy, cognitive behavioral therapy focuses on fighting off negative thoughts. So we determine the pattern of thoughts for the patient, the automatic thoughts that actually affects the behavior and emotions of the patient. Psychotherapy focuses on issues behind thoughts and feelings. Group therapy Some patients wanted to have therapy, which is in group, so they share problems with other people in the same situations. If you have questions, feel free to comment below, and please don't forget to subscribe.